Permanent maxillary second molar, a guide to its morphology, an easy to understand overview of the development, numbering, and the key anatomical landmark of the permanent maxillary second molar. We will cover the following things. The first one is the chronology, the timeline of the development of the tooth from initial calcification to the root completion. Numbering system, how this tooth is identified and universal Palmer and the FDI notification. Anatomical landmark, a detailed look of the cusp, roots and the surfaces from all the aspects. Timeline of development. Calcification begins at 2.5 years. Enamel gets completed around 7 to 8 years. Its eruption in the oral cavity is 12 to 13 years and the root get completed around 14 to 16 years. When the tooth emerges, only 2/3 of its root gets formed. The remaining of the root develops over the next 2 to 3 years. The tooth numbering system. There are three systems: universal, Palmer and the FDI. In universal, it is 2 for the right maxillary second molar and 15 for the left. Palmer, it is 7 with the right quadrant for the right and 7 with the left quadrant. FDI, it is 1/7 and for the right and for the left it is 2/7. Key identification features. The maxillary second molar is smaller and has less pronounced features compared to the first molar. Cusp of Caribbery is absent. Roots are less divergent and are often close together. Crown is smaller in overall dimension. Distal cusps are less developed. The buccal and the lingual aspects. The buccal aspect. Crown is shorter and narrower than the first molar. The distobuccal cusp is smaller than the mesiobuccal cusp. The two buccal roots are of similar length and have a distal inclination. The lingual aspect. The distolingual cusp is smaller, sometimes making the distobuccal cusp visible. The lingual surface is smooth with no fifth cusp. The palatal root apex is roughly in line with the distolingual cusp tip. The mesial and the distal aspect. In the mesial aspect, the buccolingual width is the same as of the first molar. Root divergence is less than the first molar. The cervical line has a slightly convexity towards the marginal ridge. In the distal aspect, the distobuccal cusp is smaller than the mesiobuccal cusp. The marginal ridge is at a lower level, often making the occlusal surface visible. The cervical line is nearly straight. The occlusal aspect. The occlusal surface holds key distinguishing features including the cusp size and the presence of the supplemental groups. Dimension. The buccolingual dimension is the same as of the first molar, but the mesiodistal dimension is about 1 mm less. Cusp. The mesiobuccal and the mesolingual cusp are well developed. The distobuccal and the distolingual cusp are smaller. Grooves and pits. The tooth features more supplement, grooves, and pits compared to the first molar, giving it a more wrinkled appearance. Occlusion outline variation. The maxillary second molar typically presents in one of the two common shapes. The rhomboidal shape. This is the most common form, featuring 4 distinct cusps that creates a rhomboid, heart-shaped tooth. It is the variation the distolingual cusp is very small on entirely absent, resulting in a 3-cusped heart-shaped crown. So, the summary of the key features of maxillary second molar are: absence of the fifth cusp, a crown that is generally smaller and narrower than the first molar, 3 roots that are less divergent and have a distal inclination, 4 cusps with the distal cusp being smaller than the mesial one, 2 primary occlusal patterns, rhomboid and heart shape. Most